Well, it turns out a daily dose of fruits and vegetables could help you get a good night's rest. Researchers from Columbia University and the University of Chicago found that eating more fruits and vegetables and more grains all beneficial for better sleep. Joining us to talk about this and other health topics is Dr. Jeff Pothof, UW Health's Chief Quality Officer. Good afternoon.
Hey, good afternoon.
Yeah, so what do you make of this study?
I think it's an interesting study. It really looked at young adults and had them record on an app what they were eating. And then they cross-checked that with a wrist monitor, like a fitness watch, that looked at their sleep, particularly like depth of sleep. Did they get to deep sleep, not fragmented, where you're kind of waking up all the time? And they found this association between these individuals who ate 5 or 6 helpings of fresh fruits and vegetables, whole grains, so kind of like good starches, and they had better sleep quality. They estimated about a 16% improvement in that sleep quality. This is just an association studies. It doesn't mean this vegetables and fruits cause good sleep, but certainly an argument for eating healthy and how it may improve sleep quality.
I think when you eat better, like even your gut feels better. You're not just so weighed down and sluggish, and I just think everything is just better.
Yeah, certainly it seems like there's something there, and I would agree. I think, when I eat poorly, I tend to feel it at night. I don't feel like I'm as rested versus, times when maybe I've done a little bit better, I feel a little more rested.
New information saying alcohol-related liver deaths rising. That's not surprising, though.
Not surprising, but not good news. So, between, 2006 and 2018, every year we'd see about a 3.5% increase in alcohol-related liver disease. Now, 2018 through 2022, during the pandemic, that increased to 9% increase per year for those 4 years. Maybe even more surprising, for men, that comes out to about 17 people per 100,000, but women went from 3 to 8 per 100,000. So a much higher increase in women than what we're seeing in men. This is worrisome because we could see this get worse before it gets better. It takes multiple years to develop liver disease from drinking alcohol. I think just a good reminder that, alcohol in any quantity, not helpful for you. If you're drinking too much, alcoholic liver disease, that's a really bad thing to come down with.
Doctor, we're taking a look at some video of pours. And, if you look back, like in the 20s, like the Great Gatsby, it was like a Dixie cup worth of alcohol. That was what was considered a cocktail. And now we've like jumbo sized it, and no one like really realizes that we're not only drinking more often, we're drinking more alcohol.
I think you make a great point, because a lot of us are like, hey, when I go out, I'm only having 2 drinks. But a drink today, it's the medicine defines it as, an ounce of alcohol, 12 ounces of beer, 8 ounces of wine. You go out and you get a mixer, you could have 2 or 3 drinks in that one mixer. You do 2, and now you're up to 6 drinks, and you don't even realize it.
Yeah, okay. Forever plastics, we are becoming more aware that they are everywhere, and kids now may even be seeing some of those effects.
This is really interesting. So this study looked at 1,100 women, and they measured levels of PFAs in their blood. And these chemicals are like everywhere. Cookware, plastics, firefighting foam. For those women who had levels that were twice as high as the baseline, they then looked at their kids over the next 18 years. And early on, they didn't say anything. But at age 18, what they found out is those mothers who had twice the level of PFAs, their kids, 17% more likely to have hypertension. Again, an association, but we're just learning a lot about these PFAs that suggest they're not great. They're really hard to get out of our environment, and they're everywhere.
All right, doctor, thank you so much for the updates. You try to stay cool, okay?
You too.
Thanks.